Hi, everyone. Welcome to the final week of our webinar in our Exercise Oncology webinar series. If you have joined us all along this semester, thank you so much for joining and for your feedback on this. Again, my whole purpose in doing these webinars is to try to build interest in the field of exercise oncology, particularly for people who are maybe majoring in exercise science or considering majoring in exercise science and don't really know what path they want to choose and a field, what a career in exercise oncology will actually look like. So it has been my honor to discuss some of the different aspects of this career and of this field with you and kind of give you a behind the scenes look at what it takes to work in this field. I know we also have a lot of people who are currently working in the field of exercise oncology who are joining us. And so I hope some of the tips and some of the practical tips that we have talked about have been helpful for you and that you've been able to implement them in your practice. Now, this week I am traveling, and so tomorrow I'm actually hoping to be in the air whenever this webinar is supposed to go live. And so I wanted to record it for you and send it out ahead of that since we won't be able to meet live. And so I have the webinar for you here. I'm going to share my screen and pull it up. Now, hopefully you all can see that. This week, what we're going to do is look at the emotional aspects of working in exercise oncology. And I think this is a really important topic to discuss because when most people think of exercise oncology, I think their minds just automatically go to the physical. So we think of sets, we think of reps, we think, what is the exercise prescription? What is the intensity? What is the fit principle? What are the measurable outcomes? All of those things. And that is important. And that data and that information is what is helping to drive this field forward. I believe it does, contribute to the positive outcomes that we're seeing with cancer. However, I do think it's important to acknowledge that exercise oncology is also deeply emotional. You're dealing with patients that are carrying a very heavy weight emotionally. And so this week, what I'm hoping to do with this webinar is to look at those emotional layers, both from the perspective of the patient and also from the perspective of the trainer. My goal is to help you understand what it feels like to work in this field, understanding the challenges, the reward, and the human side of exercise oncology. So, that being said, with this webinar, my goal is to start by looking at what patients go through emotionally as they engage in exercise during cancer treatment. And then I want to flip the lens and look at what it means for trainers to carry this emotional weight of working with this population. And then from there, I want to dig into some emotional intelligence and walk through how you can communicate, how you can listen, and how you can create safe spaces in your work. And then finally, we'll close by preparing you for the emotional realities of this career. So it is my hope that by the end of this webinar that you'll not only have more knowledge, but you'll also have more empathy and more clarity about the unique role that you can play in this field. So let's start with the patient perspective. So think about it. When a person hears the words, you have cancer, it can be one of the most emotionally devastating moments in their life. Oftentimes, patients are going to describe this as an emotional roller coaster. So there's the fear of what lies ahead. There's uncertainty about the treatment, like how is my body going to respond to this? Is it going to work? There could be sadness for how their life is changing and how their life is going to change. And oftentimes you'll also see some anger there at, feeling that this is unfair. I also see patients who have exercised, who did eat healthy prior to a diagnosis, and then they get diagnosed and they feel in a way like their body has let them down. And so I think it's important to understand these common emotions that patients are experiencing. I mean, they feel this sudden loss of control. The trajectory of their lives is going to shift overnight in a way that they probably didn't see coming. So, with all that in mind, imagine that in the middle of all of this, you're asked to exercise. I think for a lot of patients, this can feel very overwhelming, maybe even impossible for them. And I think it's going to bring a lot of questions to them. I think they're going to wonder, is exercise safe while I'm going through treatment? Is it going to make me sicker? Is it going to exacerbate my fatigue? How can I do this when I can barely get out of bed? These are not excuses. They're genuine fears that need to be addressed and addressed sensitively because these are the real experiences that patients are experiencing. However, I think it's important to realize that exercise can be profoundly healing on an emotional level, not just a physical level. And so when patients are engaging in safe and structured movement, they do regain a sense of control. In a world where treatments and side effects and appointments oftentimes can dictate every single part of their day, exercise becomes the one thing that they can actively choose. It's the one thing that they can do when so much in their life is happening outside of their control. Research consistently shows that exercise can reduce anxiety, it can reduce depression in cancer patients. We see this in the data, but also more importantly, we see this in real life work experiences when we're with patients. I have actually been able to see a visible shift in patients' faces, in their posture, and in their confidence levels. And I have seen the spark come back into a patient's eyes when they realize that they're stronger than what they thought they were. And I think that exercise really helps to teach these individuals that they have something left to give. So let's be real though. There are a lot of unique emotional challenges whenever it comes to exercise. And I have some of these listed here that I just kind of want to talk through. So first is body image. Body image can be a very big barrier for a lot of people. At Mapletree, about 90% of the patients that we worked with have never exercised before. And so, you have that fear of doing something new, but then when you consider what am I looking like? What are people thinking when they look at me? Do I look like the other people that are exercising, whether it's in a gym or in a clinical setting or wherever? I oftentimes think of women with breast cancer and can really, envision where these body image issues can come from. So imagine there's a woman with breast cancer, she's had a mastectomy, maybe she's dealing with hair loss from chemotherapy. Maybe there is some weight gain with her treatments. That is very, very common in a lot of hormone driven breast cancers. That individual, of course, she's going to be self conscious about working out in public. You may have a man who has a feeding tube or maybe a colostomy bag, and maybe they're embarrassed by the equipment that they have during exercise. And so I think that that's something that is important to acknowledge and to try to create a warm and welcoming environment so that they don't feel like they're on display. You want to meet that person where they are, and you want to just work with them and try not to, try to make them feel at ease, try to make them feel comfortable. Another thing that oftentimes can be an emotional challenge is fatigue. This is one of the most common side effects for individuals. Sometimes patients can feel discouraged if they're not able to do as much as they used to do. Sometimes in a group setting, they might be embarrassed if they can't keep up with the rest of the group. Sometimes just walking into an exercise room is an act of deep vulnerability because it's a visual acknowledgement of their cancer journey. So I once worked with a patient named Patty, and when she arrived to work with us for her very first session, she looked completely defeated. She told me that she felt weak, that she felt unsure of herself. She said, "I don't even know why I'm here," which, it is hard. Like those are hard things to hear because you know that you're there to help, you know that you're there to encourage them, and you want them to want to be there. But Patty kept showing up. She kept showing up session after session after session. And in that showing up and in that process of her keeping going, she was able to discover the things that she still was able to do. So she shifted from a mindset of defeat to a mindset of, oh, I can still do this, or my body is stronger than what I was giving it credit for. And we started to see her smiling more. She started laughing with us, with the staff. She even started to encourage other patients who were just starting out in the program. And so I think that is what the power of consistency is. I think that is the power of showing up, even when it's hard, even when maybe you don't want to. And I think it's important to know that exercise doesn't erase your cancer. It's not going to erase your cancer, but it can give a sense of hope. It can give a sense of dignity and courage to reclaim those pieces of your identity that may have shifted during cancer. And that's truly what we mean when we talk about the emotional journey of exercise oncology. It's a path that might begin in fear and uncertainty and loss of control, but gradually it will shift towards empowerment and confidence and resilience. And for the patients that we work with, exercise is not just about physical strength, it's about discovering or rediscovering who you are in the middle of one of the hardest experiences of their life. So, those are the emotional aspects that a lot of our patients are experiencing. Now, let's look at the trainer perspective. Working with cancer patients can be very, very rewarding, but it can also be very emotionally demanding in ways that few other fitness or rehab careers really prepare you for. Oftentimes, trainers in this field experience something called compassion fatigue, which is where you care so much for patients and you're so invested in their well being that it actually begins to wear on your own energy and your own outlook. So, unlike traditional fitness settings where you're not just coaching someone towards weight loss or towards an athletic performance, you're literally walking beside these people in some of the hardest and the most vulnerable moments of their life. And that emotional closeness can be very powerful, but it can be very draining if you're not mindful on how to manage it. You can also see oftentimes that boundaries can get tested. And what I mean by this is patients will see you as a safe space. You're working with them at Mapletree, we work one on one with the patients. And so they develop very close connections and very close relationships. And patients may sometimes have that freedom or feel that they can share their deepest fears, their worries that they have, the grief that they have. It's common to have patients cry in the middle of a session or sit down and tell you things that maybe they haven't told anybody else. And so, in those moments, you're not just a trainer, you are a steady presence, you are a safe place for them. And that is a privilege, but it's also a weight. And it's important that you know what your professional boundaries are so that you can care for these patients well, but also maintain those boundaries and protect yourself at the same time. And then there is the reality of grief. And I think that that's important to note. We have such positive outcomes, we see such great things happen with patients who exercise, but cancer is still cancer. And in this work, you will lose patience. Sometimes, despite every effort, every treatment, the health is going to decline. Maybe the treatment doesn't work. No matter how many times it happens, no matter how many times you lose someone, it doesn't get easier. And it's important to know that that grief that you feel is real and acknowledging it is important. At the same time, I think it's important to learn how to balance professionalism with empathy. So you want to be compassionate, you want to be supportive, but you also are there to execute a safe, structured, and effective exercise session. So you don't want to allow those emotions, whether they're yours or whether they're the patient's, to completely derail the session. You can't ignore them, but you want to try to find that balance. And sometimes that's going to be one of the most critical skills that you can develop. And then along with these challenges does come a lot of rewards because I truly believe that exercise oncology is unlike any other field. You're going to see resilience every single day in your patients, and that is going to inspire you. You'll see joy on a patient's face when they do something that they didn't necessarily think they could do. You'll when their fatigue starts to lift, you can celebrate that with them, and so you get to watch people have these breakthroughs, and it is really cool to know that you play just a very small part in that. And the connections that you make in this field really do run deep. These relationships that grow out of these works can be life-changing, not only for the patient, but for you as the professional. And many trainers say that they've grown more compassionate, more resilient, and even more grateful in their own lives because of what they've witnessed in this role. So there are a lot of rewards. But because the emotional weight of this field can be so real, I really believe that self-care is a non-negotiable. I believe that as exercise professionals, we need concrete strategies to sustain ourselves in this work. And so some of the things that you can do to kind of help take care of yourself. Number one is debrief with colleagues after difficult sessions. So carrying these emotions alone can oftentimes feel isolating. So talking it through with teammates can help create support. It can help give you a different perspective. And I think it's really important. It also can help them down the line if they experience something similar. I think it's also important that we practice mindfulness and boundaries so that we can be fully present when we're with a patient, but also giving ourselves permission to afterwards step back and recharge. And it's important to learn how to leave the session in the session so that you're not carrying that weight into every single corner of your life. And then also recognize the signs of burnout early. So if you notice that you're starting to feel emotionally numb, you might be feeling irritable or exhausted or maybe even detached. I think those are signals that you should seek support, whether it's from mentors or supervisors or professional counseling. So, in short, trainers in exercise oncology are not just exercise professionals. Your listeners, your supporters, and oftentimes your emotional anchors for your patients. And that role requires intentional care for yourself as much as for your patients. The stronger and the healthier you are emotionally, the better you'll be able to serve those around you. So let's look at how we can go about building emotional intelligence in exercise oncology. This is the ability to recognize, to understand, and to manage emotions both in yourself and in others. And this begins with communication. That includes active listening, which really means more than just hearing the words that the patient is saying. It means picking up on their tone, their body language, what's in between the lines. Sometimes a patient may say something like, "Oh, I'm fine," but their eyes and their posture are going to tell you otherwise. So, pausing, leaning in, showing that genuine interest, and is going to communicate that you see them and that you care. And then validation is another really key tool. Patients don't really want us to fix every problem, but it is important that they know that their feelings are real. And so sometimes simple statements like, "I can see this is really hard for you," or "It makes sense why you would feel this way after what you've been through," can really go a long way. Now, what not to say is also just as important. So you want to avoid minimizing statements like, "Oh, well, at least you got it early," or "You just need to stay positive," or even worse, other people may have it really much off worse than you. And so, just be thankful you're not them. I know that sometimes this can be meant to encourage, but it can really feel dismissive. And so instead, I think it's important that we keep it empathetic and open, saying things like, "I know this isn't easy for you. I'm here to walk this with you." Things like that can really go a long way. You also want to try to take steps to create safe and supportive statements. So, different patients are going to want different things. Sometimes patients are going to be open to talking about their fears and they're going to want to talk about their fears. And then other times, people might come to exercise as a way to escape talking about cancer. And so, realizing and respecting both is going to be very important. You don't want to force conversations, and you just want to let them to happen naturally. And sometimes the best support that we can give is just giving a normal, encouraging workout environment and letting things happen naturally. So, for example, if you have a patient who says, "I don't want to talk about cancer while I'm here," then keep that session focused on movement, on encouragement, and on positive reinforcement. On the other hand, you might have another patient that is going to open up about the fears that they have, and simply giving them that space to talk while gently keeping them active can make that session both emotionally and physically healing. Next comes adjusting based on the emotional state of the individual. And so this means having flexibility. If a patient comes in and you can see that they're visibly discouraged or overwhelmed, maybe today isn't the best day to push them with new strength goals. Instead, let's shift the focus. Let's encourage them for simply showing up. Let's highlight what they can do, and let's create small wins for those patients. Sometimes I think it's important to realize that a positive experience is more valuable than completing that quote unquote perfect workout. Now, on the flip side, if a patient comes in and they're energized and they're motivated, lean into that and use that as a chance to challenge them and to safely build momentum for them. So, I think a practical way that you can kind of assess this in your patients is to always start sessions with a quick emotional check in. So, ask them, how are you feeling today, physically and emotionally? And that will help you to set the tone and adapt as needed. It's also important to manage your own emotions. So, this emotional intelligence isn't just about you dealing with patients, it's also to help you manage yourself. And so, that begins with self awareness. So, notice your emotions when a patient is sharing something heavy. Does that make you feel sad? Does that make you feel anxious or overwhelmed? Acknowledge that privately, but don't let it shift the spotlight away from the patient. With boundaries, remember that you are a professional support, but you're not their therapist. You can listen with them, you can have empathy, you can provide encouragement, but understand that your role really is to guide them safely through exercise. And I think it might be helpful to have a phrase ready when emotions go deeper than your scope of practice. You can say something like, "Thank you for sharing that. I realize that sounds really tough. Have you had a chance to talk with your doctor or your counselor about that?" So that will validate the patient while redirecting them to the appropriate support. And the big takeaway I think in all of this is that emotional intelligence really isn't just a bonus skill in exercise oncology. I believe that it's a core competency. So patients need to know that they are working with someone who knows how to connect, knows how to support them, and knows how to empower them both physically and emotionally. And as an exercise professional, you can give your patients the strength to face cancer, again, both physically and emotionally. And in doing that, you can transform an exercise program into a lifeline of hope. So, thank you so much for joining me, not only today, but throughout this webinar series. I've really enjoyed diving deep and digging into these topics with you. If you have any suggestions for any other future webinar topics, please feel free to reach out to us. We're always looking for new content to share and new tips and tricks to share. Have a great day, and thanks so much for joining.